Hello, my name is Patrice. I'm going to be your nurse today. Can you tell me your name and date of birth?
My name is Colleen Munson. I was born May 14th, 1964.
Okay, perfect. And do you know where we are right now?
We're at Midlands Clinic.
Yes. And what's today's date?
It's October 23rd,
Yes, very good.
2024.
Very good. So already I can tell that my patient is oriented times 3. And it looks like we're doing an annual physical today. So I just have a couple questions to start off with. Can you tell me a little bit about your lifestyle and how that looks right now? Are you working or retired or?
I'm a teacher's assistant, so
Okay.
I pretty much from 7 a.m. till 3:30, I'm running after little kids. So keeps me pretty active.
Busy
Yeah.
days. Okay. So mostly what you do is like walking for activity then?
Walking, also I'm bending down, I'm getting down on the ground and back
Okay.
up. So I'm doing, kind of a variety, but mostly, a lot of walking.
Okay, good. Yeah. Do you follow a special diet or how does your diet look right now?
I eat a pretty good breakfast, lunch, dinner. Breakfast is oatmeal, coffee. Lunch, maybe a sandwich and fruit. Dinner is maybe veggie and some kind of a sandwich or meat or something
Okay.
along there. But I suppose I really feel like I should up my veggies a little
Yeah, I think we all could. Yeah. But it sounds pretty well balanced, so yeah. Can you tell me about any conditions or diseases that may run in your family?
Well, my mother had colon cancer that she was diagnosed with in her early 80s.
Okay.
She thought that she, was so shocked. Well, why did I get this? I eat so healthy, but I'm not so sure. I really felt like she had a lot of processed foods, and she had a lot of alcohol that
Yeah.
she
Oh,
drank
I'm
as well.
sorry.
Yeah.
Yeah.
But it developed early 80s.
Yeah.
In her
Okay.
80s.
Okay. Did she have any like heart conditions or anything?
She did require a stent, and that was once also in her later on in life, early 80s.
Oh, okay. Okay. Let's see. And then are you taking any like prescribed medication right now?
No, I'm not. I take
Okay.
just a multivitamin in the morning. Sometimes I might take a Benadryl, depending upon if I feel stuffed up from, especially like maybe fall and spring.
Okay, so just a Benadryl PRN and then the multivitamin. Do you
Just one a day, women's one a day.
women's one a day? Okay. Okay. Do you have any allergies that you know of?
No.
None. Okay. And then have you had any procedures or surgeries in the past?
Well, I don't think it's a surgery that during the births of my children, they stitch you up.
Oh, okay.
Other than that,
Yeah.
that's about it.
Were those C-sections at all, or were
No,
those
it was vaginal births.
all vaginal? Yeah. Okay. How many kids did you have?
4.
4. Okay. And then do you know, are there any plans for future procedures that you're aware of?
No.
Okay. And then lastly, we just screen all patients for mental health concerns. Have you had any thoughts of harming yourself or others?
No.
No? Okay. Have you felt down or depressed at all lately?
A little bit.
A little bit?
I had to have my dog put down on Monday, and yeah. So
Yeah.
I'm a little bit, I'm a lot sad about that, but
Well, yeah, that's understandable. Yeah, definitely. And, we can provide you with some resources that can help you through that. But yeah, I'm sorry. That's really tough.
it is.
Okay, well, I'm
Thanks.
going to grab your vital signs if that's okay.
Sure.
So we would be checking blood pressure, and pulse, oxygen, temperature, and then respirations. Are you experiencing any pain at all?
No.
No. So on a scale of 0 to 10, it'd be a 0.
Yes.
Okay. All right. Is this arm okay for your blood pressure?
Sure.
Okay. Okay. And then I'm going to shine a light into your eyes, okay? I'm just checking your pupils.
Okay.
So I'm just going to have you look straight ahead. Okay? Okay, good. And one more. Okay, very good. And can I have you open your mouth? I'm just going to take a look inside. There you go. Very good. Okay. And I'm going to check your nose. Okay, good. And your ear. Okay. And checking for any lesions or lumps or anything. And I don't feel any, so that's good. Okay. And blood pressure was 113/73, so that's perfect. Okay. And then when inspecting the mouth, we're checking the mucous membranes, looking for hydration status. We're also looking for, enlarged or swollen tonsils at all, thrush on the tongue, and then like any, dental concerns that we may need to be aware of. And then with the ears, if I had any further concerns, I could use an otoscope to look a little bit closer into the ear. Okay. And then otherwise, I'm just kind of assessing her hearing through her responses during the conversation. And so far, she's not saying, what, asking me to repeat myself. So far, so good. Okay, and then I'm just going to take a listen to your heart, if that's okay.
Sure.
Okay, so we're going to listen to the apical pulse for 30 seconds if it sounds consistent and normal. Okay, so it was 64, so that is normal. That's within normal range. And then, so I'd be listening for like a murmur or something like that. And I'm also going to take a listen to your lungs. All right, give me a big inhale and exhale. Okay. Good. One more. Okay. Good. And your backside. Again. One more. I lied. One more. Okay, perfect. So I'm also checking her respiratory effort, making sure that her chest rise and fall is symmetrical, that she's not using like accessory muscles to breathe, and she's not, so there's no signs of respiratory distress from what I can tell. Okay, and then I'm just going to feel for your radial pulses. Okay, very good. Kind of taking note of the color and temperature of her hands. So they're warm, not cyanotic at all. And then I'm going to check your capillary fill. Okay, in less than 3 seconds, so that's normal. Can you squeeze my hands? All right, very good. Can you pull me towards you? Good, and push me away. Very good. Good job.
Okay, sorry.
Okay, so with that, we would want to, see if one side is weaker or stronger than the other, looking for, symptoms of like a stroke. Okay, and then I'm going to take a listen to your belly, if that's okay.
Sure.
So we want to auscultate before we palpate, and we're going to start in the right lower quadrant and then work clockwise. Okay, good. Okay, good. Oh. Is that still going? Okay. Okay, so bowel sounds sound normal. Not hyper or hypoactive. And have you had any changes with your bowel movements lately?
No.
No, okay. No liquid, bloody, or dark stools?
No.
No, okay. You said you haven't had your colonoscopy yet?
No, I have not.
Okay. Okay, so yeah, we'll just try to get that scheduled at some point. But yeah, it is important to auscultate the bowels before we palpate so that we're not moving stool around. Okay. And then at this time, I would also be assessing genitalia in a hospital setting, but I would also, wait when it's more appropriate. Honey? Okay. I would also wait for it to be more appropriate for the patient, like when they're going to the bathroom or if I'm performing catheter care. And then are you urinating regularly?
Yes.
Yes, okay. No increased frequency lately, or?
No, I think on average from like 7 a.m. till about 3:30, I would say I go at least like 6 times because I'm frequently drinking water and like vitamin water, so.
Good, okay, yeah. And then no burning or pain when you're going? Okay, good. Okay. And then lastly, I just want to check your legs and your feet if that's okay.
Of course.
Okay. We got our little guest. Okay, good. And I can already see that she's raising her legs without any additional help. Okay, so with this, we're just checking for any swelling or edema. I'm also noting the color. So if it's darker, we'd be looking at like a venous insufficiency, or paler, maybe an arterial insufficiency. And the temperature is normal, so that's good. And then we also want to check that pedal pulse. Okay, good. Okay, good. Have you noticed any like decreased sensation in your feet at all?
No.
No? Okay. All right. And that's important to screen for, to make sure that there's no like neuropathy for going on for like an underlying condition that we're not aware of. And then I'm going to have you flex your feet. Flex them. There you go. All right. And then point them. All right. Good. So you guys,
that's kind of an exercise I do in the morning too, before I get out of bed, because I think it's really important to do a few stretches. Then you're just not cold. Out.
Mm-hmm. For sure. Okay, yeah. And then have you noticed any like changes with your walking or like balance at all?
No.
No? Okay. Yeah, and then in the hospital, I would be assessing this throughout the day with my patient, making sure that there's no sudden changes to their balance or change in mental status or speech, no slurring or anything. And then did you have any other concerns you would like me to mention to the provider?
No. I just got a flu shot about a month ago. Would you recommend a COVID shot this year?
Yeah, I think so. Yeah, that would be good, especially, considering how much more it's going around right now, too. There's definitely, increased rates, so. Okay, well, thank you so much.
Yeah, thank you.
Yeah.